I think one of the things that the local residents in the area need to remember is that Dr. Scarpone is a physician that start that area.
You're ready.
On behalf of Trinity Health System, one of the things that we really appreciate about Dr. Scarpone is his ability to start new programs and to carry those through. The head injury program, the ACL program, the throwing programs that he's started will help local athletes remain healthy and be proactive in keeping themselves healthy and not getting injured. So if you want to excel in the sport that you're participating in, no matter what it is, go see Dr. Scarpone. He'll make you a better athlete.
Action.
As a coach for Harrison Central girls basketball team, it's very nice to know that we have an athletic trainer on staff for all practices and games, knowing that she's going to do the best thing possible for our athletes, get them back as soon as possible without jeopardizing their well-being. It eases a lot of the anxiety once you see one of your athletes come down, knowing that she's there to take care of them and we don't have to worry about that.
Action.
As the head coach of the Harrison Central girls basketball team, it's very nice to know that we have the services of an athletic trainer on staff available for the games and practices, knowing that if an athlete goes down, she's there to take care of them, get them back as quickly as possible without jeopardizing their well-being. It eases a lot of the anxiety when one of your athletes go down, that you know someone's there to get them back as quickly as possible without harming them.
And action.
I'm Coach Nick Yorkovich, Harrison Central girls basketball team. I would strongly recommend the services of the athletic training program from Dr. Scarpone. It's very beneficial to your school, not only for your athletic teams, but also for special events.
Ready and action.
I'm Coach Nick Yorkovich, Harrison Central girls basketball team. I would strongly recommend the services of Dr. Scarpone and his athletic trainers. It's very beneficial to your program, whatever it may be, football, basketball, baseball, or even for special events that you may have.
You know, we now have an actual standard by which we can put kids back on the field, and I think it makes the parents, the coaches, and the kids a lot more reassured when they take the field.
Now, do you have any experience? Do you feel like the big thing coaches have about the impact, if they don't understand it, is it's going to hold them out longer?
I just think the way it works now is that I just think it's more, I guess the word I'm looking for is like more ironclad, because now you know it's a science, not a guessing game. And I think before we were kind of guessing,
which maybe took longer.
You know, and sometimes you had to give them the benefit of the doubt longer time. Now you really can release them sooner if they're all right.
Yeah, we can hit that point, because that way when the coaches that are kind of iffy.
And just don't look at the camera.
Do you want me to say where I am? My name's Andrew Conner. I'm the head football coach at Indian Creek High School. In my tenure as head football coach at Indian Creek, I've been very fortunate to have worked with Dr. Scarpone and his staff. I believe they're a huge asset to any football program or any sports program. They've been able to cover our practices and our games, and they've alleviated a lot of pressure for me as a coach to diagnose and to treat our football players. We were fortunate last year to start our concussion streamlining program through Dr. Scarpone. It has made a huge impact on our football program because it allows us now to use a science to test our kids on whether or not the impact of a hit has allowed them to go back on the football field. With the dangers we know today of concussions, allowing us to have this as a tool to judge our football players has really aided us as a football program. Last year we were fortunate through Dr. Scarpone's office and with his staff to start our baseline testing of concussions. Today you hear a lot of information about concussions, and we are fortunate now to have a scientific tool to judge our kids so that we don't put our kids back on a football field before they've been tested and cleared to go out on the field. Jamie, and the fact that we have somebody at our practices, and the fact that she's able to get a hold of Dr. Scarpone and how quickly he sees our football players. I mean, we can do that right away. I mean,
You can say something about.
By working with Dr. Scarpone and his staff, we have easier access to get our athletes in quicker to see Dr. Scarpone so they can start their treatment process right away. We also have access to Saturday mornings when Dr. Scarpone allows our athletes, and that's athletes all across the Ohio Valley, to go to his sports med to get rehabilitation right after an injury on Friday night.
Action.
In working with Dr. Scarpone and his staff, we have access to get our athletes over to Dr. Scarpone quicker so they can receive their treatment in a much faster way. We also are able to then allow our athletes to attend their sports med clinic, which is on Saturday mornings, which all the athletes in the Ohio Valley are able to go to get rehab faster, to get on the field quicker.
And action.
My name is Andrew Conn. I'm the head football coach at Indian Creek High School. I would recommend that Dr. Scarpone and his staff become an integral part of your program. Over the years, he's become a huge asset to our program.
And action.
Hi, I'm Dr. Michael Scarpone.
Start over.
Sorry, I'm my favorite.
We'll do it two ways. One to the camera.
Oh, which way?
And action.
Hi, I'm Michael Scarpone, and I'm the Medical Director of Trinity Sports Medicine. I also work for the Pittsburgh Pirates as a team physician, and I'm an assistant professor of sports medicine at Allegheny General Hospital campus. I just want to highlight some of the new things that are developing here at Trinity Sports Medicine. One is we're moving into the new wellness center at the St. John Arena, and that's going to bring a lot of more programmatic capabilities to our athletic training program and personal training programs. Let's see.
Okay.
There's also going to be new procedures with a new procedure room here at the arena facility, and also at the outpatient center at Trinity Medical Center West. These new treatments are going to include 10X for treatment of tendinopathies and calcific tendon disease, which is a minimally invasive technique which can be done under a local anesthetic, under ultrasound guidance, to help tendon disease that previously had to have open surgery. The other things we are doing is working with some regenerative medicine treatments and research regarding using patients' own precursor tissues and cells from bone marrow and fat, along with their growth factors and their platelets, to help heal injuries of various kinds. There are three regenerative techniques we basically use to help heal tissues. One is basic platelet-rich plasma, or PRP, which is taking some of your blood and getting your platelet concentrate made from your own healing factors, and then under ultrasound guidance or under fluoroscopy, we locally anesthetize the area and reimplant those platelets into the damaged tissue. That works quite well for multiple types of injuries that aren't severe. The other treatments, there's using platelets with fat, and the fat acts as a matrix, in other words, a filler, and it also has active precursor musculoskeletal cells in the tissue of the fat that helps heal the area and provide more cellular material for bigger injuries. And then last, there's bone marrow aspirate concentrate, or BMAC, that we can use, where we take bone marrow from the patient and then move that into the injured area. And sometimes we can combine that with fat too, if necessary.
Action.
One of the other recent developments in our program is the Impact Concussion Testing Program, along with balance and coordination testing.
Action.
Impact Concussion is another testing.
Couldn't start again.
Impact.
Action.
Impact concussion testing is I did it
Start
again.
over. Start over. Start over. Action.
Here we go. Now it's going to start. Impact testing brings state-of-the-art concussion. I'm losing the word
It's
here.
all right.
State-of-the-art. The Impact program brings state-of-the-art concussion testing to the area. Impact is a computerized I want to say psychosocial. It's not Impact testing is a neurocognitive computerized test that allows us to understand brain function after an injury